Good afternoon. My name is Fred Seavey. I'm the research director at the National Union of Healthcare Workers. And I wanted to walk through a quick PowerPoint that will lay out some foundation as far as the kinds of difficulties we're facing here in California and the sorts of practices inside of Kaiser. After this, we're going to move to a panel of both patients, family members, and therapists. So both Sal and Senator Beall spoke a little bit about some of the national statistics with mental health. Here in California, roughly nearly 1 in 6 adults in California experiences mental illness in any given year. This March, the California Healthcare Foundation published a study, and they found that the prevalence of major depressive episodes among adolescents increased by 50% since 2013. So roughly 1 in 8 adolescents reported experiencing a major depressive episode during the past year. There's also a huge problem in terms of lack of treatment. 63% of adults with a mental illness here in California do not receive any treatment whatsoever. And it's roughly a similar percentage for teenagers with depression. Just about 1/3 of teenagers receive treatment. So how does Kaiser fit into this picture? Kaiser is our state's largest HMO. It has roughly, it's also the largest provider of mental health services in our state. Has about 8.6 million enrollees in our state. So a lot of these things, we would argue, are reflective of Kaiser's capacity and its delivery system. So Kaiser, because of its size and prominence in the state, bears responsibility for some of these statistics. So how's Kaiser doing with respect to mental health? We have a lot of experts in the room, a lot of therapists, family members, patients. But I wanted to turn especially to our state's regulator. What do they say about Kaiser's performance? In June of 2013, the Department of Managed Healthcare fined Kaiser $4 million, the second largest fine in its history, for a wide variety of mental health violations, including violations of the California Mental Health Parity Act, timely access regulations, network adequacy violations. And this resulted from a complaint that was filed by therapists in the National Union of Healthcare Workers. The violations were so severe that the state issued an immediate cease and desist order. They ordered expedited follow-up investigations and then did a series of follow-up inspections. The first of which was concluded in February 2015. Kaiser failed that investigation. Investigators went through and did a random sample of 300 patients' charts from 11 medical centers, and they found that in Northern California, 22% of the patients whose charts they sampled indicated excessive appointment wait times for both initial appointments and follow-up appointments. In June of 2017, Kaiser failed yet another inspection. 1 month later, the Department of Managed Healthcare entered into a settlement agreement with Kaiser that requires Kaiser to go under outside monitoring for up until 2020. Kaiser has to hit a series of performance benchmarks. But one thing, looking at this picture that stands out to me, we're now in 2018, 5 years after Kaiser was fined for delaying care for thousands, and this was documented in the state's reports. Literally thousands of patients were receiving delayed care that violated the maximum time frame set out in California law. Kaiser has still not fixed the problem. The other thing that's notable to me is the failure of our state's oversight agency. Like me, you might have gotten a fix-it ticket by the police at some point. Your blinker's not working, you don't have that sticker on your license plate. Kaiser got a fix-it ticket, but it was a big one for failing to give care to thousands of patients. And 5 years later, they've still not fixed it, and our state oversight agency has not penalized them. They've not held them to account for those violations. So we have a serious problem there. And in addition to this, the regulatory track record, patients have also joined together and filed 2 class action lawsuits that are moving their way through the courts. But this is another indication in terms of the failed services at Kaiser, or the problematic services there. So I want to turn now to the problems that the therapists describe inside the clinics, and there are 5 of them. The first is understaffed clinics. We did a survey among therapists in California in recent months. 87% of therapists practicing in the psychiatry department reported that their clinics are so understaffed that their patients do not receive timely and clinically appropriate care. So there's a huge problem with the understaffing. Secondly, in recent years, Kaiser has added many more enrollees. Since 2015, it's almost 1 million additional enrollees or members here in California. Kaiser will say that, oh, we've added hundreds more therapists, but at the same time, they've added many, many more, much larger patient population. So their workforce hasn't expanded at the rate of its enrollment growth. And furthermore, many of the new patients, there's a large influx of Medi-Cal enrollees into Kaiser, tend to have higher acuity levels, and it requires much more time, more frequent appointments on the part of therapists. So that's number 2. And actually, this is just a chart. Kaiser provides our union with statistics on the growth of its workforce. So we put here the top line, the blue one, is the Kaiser membership. So you can see how it's grown from 2015 to 2018, but this really substantial growth. The bottom line, the one in red, is the therapist workforce in Northern California. But as you can see, they're going up sort of together. Kaiser has not solved this historical sort of deficit in terms of staffing levels inside the clinics. So the third problem that therapists describe, and patients and family members as well, there's excessive appointment wait times. The understaffing inside the clinics forces patients to wait 4, 6, 8 weeks between return treatment appointments. Kaiser has focused, regulators first fined Kaiser for failing to provide timely initial appointments. So they're kind of teaching to the test. They're front-loading their clinical capacity to provide more rapid initial appointments. And now those are the appointments where the patients receive an initial diagnosis and treatment plan. What follows then are the treatment appointments. It should be a series of treatment appointments attuned to the diagnosis of the patient. But those are the ones that are really delayed. So often our therapists speak about this as rapid access to delayed care. They've front-loaded again, the clinical capacity to focus on the first appointment, but then give delayed care subsequently. So these aren't only things that we observe. We've actually gotten some internal records. These are records that come from a meeting of the Southern California Quality Committee. It's a group inside of Kaiser, top officials, including the president of the Southern California region, top regulatory officials inside of Kaiser. And again, this is dated October 26 of 2018. But this is what they write about their own, this is in the San Diego region. Return access for routine psychotherapy is suffering with next appointments available in 4 to 6 weeks. The severe return access situation is stressing our ability to follow up with urgent cases. Elsewhere in the document, they speak about a backlog of return therapy cases for providers. And elsewhere, talk about, say, return access struggle continues to be a struggle for the adult and child psychiatrists. Additional position adjustments are needed. The other area that's often spoken about by both patients and clinicians are the under-resourced independent contractors. Kaiser, in an attempt to kind of plug the holes in its leaky ship, has contracted with Beacon and Magellan, formerly called Value Options, to provide independent or community therapists to deliver therapy appointments. But consumers have a huge difficulty getting care. Many of these community therapists are not adequately reimbursed. They don't want to take the Kaiser patients. And so patients will have to go through this enormous task of phoning therapists, dozens of therapists, to try to find one who is willing to care for them. Furthermore, these independent contractors are not integrated into Kaiser's care. They don't have access to medical records, and they're not integrated into get the full picture of the patient's health altogether. So it's not integrated and coordinated care. So lastly, the other thing we see is that Kaiser, again, it's sort of another how to plug the leaking holes in the ship. They're simply speeding up the patient assembly line, trying to get the patients to do shorter appointments and therapists to do things faster and faster. So for example, it's the the standard practice in psychotherapy for an initial assessment to take about 60 minutes. This is the patient's first appointment where the therapist performs a set of diagnostic questions and arrives at a treatment plan. Kaiser's trying to cut those appointments in half from 60 minutes to 30 minutes. And they're wanting to get, to provide the care to the greater patient population on the cheap by just speeding up the assembly line. So what are therapist solutions? These are the main proposals we have in front of Kaiser. One, we want to increase the availability of treatment appointments in therapist schedules so patients don't have to wait a month or 2 months for treatment appointments. Number two, Kaiser must hire more clinicians. We've built in our proposals a mechanism that would require Kaiser clinics to hire more therapists when they cannot meet access requirements. Number three, we want Kaiser to give therapists the latitude to exercise their clinical judgment to provide the type and frequency of care that they deem necessary for their patients. Number four, Kaiser has to fix the problem of recruitment and retention, and the first step to doing that is simply providing therapists with the same pay increases and same benefits that it provides to other Kaiser staff. And then lastly, as far as the outsourced therapists, Kaiser needs to boost its staffing internally so that patients don't have to confront the system requirement to call through dozens of external therapists to try to find one, and also therapists that aren't equipped with medical records and charts and an integrated system of care to provide the best sort of care to their patients. So can Kaiser afford to improve its care? Yes. Absolutely. So since 2016, Kaiser has reported $9.8 billion in profits. As of September 30th, it had about $43 billion in cash and investments on the books. Its CEO and its executives are not suffering. Last year, Kaiser gave its CEO, Bernard Tyson, a $6 million pay increase, bumped his pay to $16 million a year. There are 36 Kaiser executives at least who earn more than $1 million a year, and those top executives receive 8 separate retirement plans and pension plans.
Some nonprofit.
Yes, so nonprofit. So this morning, Kaiser ran a full-page ad in the LA Times, and Senator Beall, I guess they ran it in San Jose as well, saying that they want to put patients first. We know that they have the resources to do it, and that's our challenge, is to force them to do what they should have done 5 years ago. With that, I'd like to introduce Vanessa Coe. Vanessa herself is a therapist, trained as a therapist, and worked in a nonprofit health clinic here in California, in Oakland, before joining the NUHW staff, and she'll be leading the next section of the agenda.